Hello guys, I am Dr. Khan and today we are going to discuss about urinary system. So the urinary system consists of these organs: the two kidneys, the two ureters, the urinary bladder and the urethra. Okay? So we will start first from the kidneys. The kidney is a bean-like structure and it's to a number the right kidney and the left kidney. But in the picture you can see that the right kidneys lie slightly lower than the left kidney because of the large size of the right lobe of the liver. Depress the right kidney. The kidneys lie behind the peritoneum, high up on the posterior abdominal wall on either side of the vertebral column. They are largely under cover of the costal margin. Okay? The outer surface of the kidney is called cortex, while the inner side of the kidney is called medulla. Function of the kidney. Kidney performs several vital functions, but first we will discuss the endocrine function of the kidneys. Kidney secretes many hormones such as erythropoietin, thrombopoietin, renin, and 125 dehydroxycholecalciferol and prostaglandin. About these hormones we will discuss in endocrine system. But for now, the urine formation by the kidneys, how the kidneys make the urines. Okay, so first of all you have to know that the both kidney receive about 1300 milliliter of the blood per minute, about 25% of the cardiac output. Kidney are the second organ that receive the maximum blood flow, the first organ being the liver. We will discuss about the liver later. And each kidney consists of 1 million nephron. Okay, those nephron which making a capillary networks and form the glomerular membranes. The glomerular membrane is a perforated, there are small many holes in the glomerular membrane. The urine formation include three processes: the glomerular filtration, the tubular reabsorption and the tubular secretions. So the glomerular filtration is the process by which the blood that passes through the glomerular capillaries is filtered through the filtration membrane. This is the first process of the urine formations. In this process, the water, the urea, the uric acid and other metabolic substances filtering to the glomerular membranes. Okay, so when these substance filtering, along with that there are some electrolytes such as sodium, potassium and other substance electrolyte also filtering along with water, urea and uric acid. The next one process is the tubular reabsorption. Okay, so the tubular reabsorption is the process in which the water and other substance are transported from the renal tubule back to the blood. The last one process of the urine formation is the tubular secretion. The tubular secretion is the process in which the substances are transported from the blood and to the renal tubules. It's also called tubular excretions. So the formation of urine is passing from these three processes. Okay. Now the next organs are the two ureters. The two ureters are muscular tube that extend from the kidney to the posterior surface of the urinary bladder. Okay, the size of the ureters. So each ureter is about 25 centimeter long. The function of the ureters. So both the ureters carry the excretory substance from the kidney or the urine from the kidney to the urinary bladder. Now the next one organ is the urinary bladder. The urinary bladder is a spherical shape, okay, and there are two openings for two ureter and the urinary bladders. So the urinary bladder can store 400 to 600 milliliter of urine. Now the last one organ of the urinary system is the urethra. The urethra is a tube-like structures, and the function of the urethra, so it's carry the urines from the urinary bladder